Welcome to the American Lung Association's Public Health Roadmap to Coaching a Clinical Team to Use the Million Hearts Tobacco Cessation Change Package. Next slide. This webcast is being recorded. The recording of this webcast will be added to our on-demand resources at lung.org/cessation TA. Need to step away? You can pause or reverse this webcast at any time during the live event. You can view the webcast again by using the same link that you used to log on today. Next slide. The live event Q&A feature, located at the right side of the event window, is being used during the live webcast on September 24th at 11 a.m. Central Standard Time. Polling links will be shared in the live event Q&A box, so please share your feedback with us in real time during the live event. If you have any questions about content or if you're having technical difficulties, send us a message. We will try to answer as many content-related questions as we can during this webcast. So if you have questions about the roadmap, please send them to us and we'll do our best to address them during the Q&A portion of the webcast. Next slide. So again, welcome everyone. We really appreciate your participation in this webcast. I'd like to take a moment to introduce you all to the Lung Association's Cessation Technical Assistance Team. My name is Rebecca Padilla, and I'm the National Manager for Tobacco Programs. I'm joined today on the webcast by my teammates Jen Folkenroth, National Senior Director, Tobacco Programs, and Ann DiGilio, National Director, Lung Health Policy. Next slide. Tobacco use is the single most preventable cause of disease, disability, and death in the United States. Cessation services and resources are more important than ever to address this significant public health problem. We know that access to treatment can double the odds of success for people that want to quit. And that's why health systems changes to integrate treatment into routine care is so important. Our technical assistance team has expertise on health systems change to increase tobacco cessation. We can provide you with guidance on electronic health record implementation, quality measures, hospital community benefit requirements, and how emerging issues will impact tobacco cessation in health systems. You can access resources for these issues and so much more on our website, including links for on-demand webcasts, podcasts, and toolkits. And please don't forget to subscribe to our Cessation TA listserv, where you can find peer-to-peer support. You can also email our team at any time for direct one-on-one technical assistance. Next slide, please. Now that you've learned a little bit about our team, we would like to hear more from you. Jen?
Hi, thank you all so much. And hello, everyone. Thank you for taking the time to hop on today. To take advantage of this time we have together, we're really looking for the opportunity that it presents to hear from all of you. So we've built out an assessment and are seeking 100% participation and engagement among all of our attendees in 4 polling questions that will take place throughout today's webcast, as well as 10 post-webcast assessment questions at the conclusion of our discussion. We feel this is just really important to hear from all of you in helping to continue to navigate our discussion for today, as well as future projects and collaborative opportunities moving forward. So there are 2 ways that you can participate in today's assessment that will go right along with the webcast. We would love to ask that you either participate on your computer, clicking the link that we are adding in the chat box, or to take your cell phone and go ahead and cue it right up with your screen and take a snapshot of that QR code. It will take you directly to the link as well, and you can even participate on your cell phone while we're together today. So please take a moment. Once you have that all up, just want to make sure that that is in the chat. Going to make sure that, oh, perfect. Okay. Now that you all have that up, if you could go ahead and fill out just the preliminary information, just your name, email address, and what state or territory you are representing today. And in addition, we're going to kick it off with our first question, our first assessment question, in really wanting to know a little bit more about your experience and expertise in the realm of tobacco cessation and health systems change. So if you could please take a moment and go ahead and answer the first question. When it comes to my current level of knowledge of tobacco cessation, health systems change, I'd consider myself. Go ahead and rate that. Okay. Please note the American Lung Association, we greatly appreciate your feedback as we're working to assist public health professionals in tobacco control programs to promote health systems change to really increase tobacco cessation. So thank you all so much for your participation. I'm going to turn it back over, but I will be popping back in for the next polling question a little down the road. Next slide, please.
Thanks so much, Jen. So in today's webcast, we will identify different audiences who work on health systems change, review tools tailored to each audience, present the structure of our new public health roadmap, and we'll show you how to use this new tool through some case scenarios. We've carved out some time today for Q&A, so as your questions arise, please be sure to send them to us using the live event Q&A box located on the right side of the event window. And then we'll wrap things up with additional resources as well as an overview of our post-webcast needs assessment. Next slide. I'm excited to introduce you all to our two speakers today. Claire Brockbank is the founder of Segue Consulting. Claire received an MS in Health Policy and Management from Harvard University and her undergraduate degree from Stanford University. She's dedicated her talents to promoting mutually beneficial health and wellness strategies between public health and private carriers. Michelle Paterino is a partner consultant with Segue, bringing with her 20 years of experience in tobacco control programming, healthcare provider engagement, and education. Together, this consulting duo has worked with CDC and several state governments in working to promote better access to, better utilization of, and more equitable approaches to tobacco use prevention and cessation. We are so grateful to have them with us today to navigate us through the newest of available resources in furthering efforts throughout the states you serve. So with that, I'm excited to have Michelle take the wheel and introduce you all to our new public health roadmap. Michelle?
Thank you, Rebecca, and good morning to everyone. So as we get started, it will not be surprising to you all that the driving force behind this public health roadmap is really the emphasis on health systems change that's in the CDC grants to the states that many of you have obviously been involved with. So while we know clinicians are required to implement health systems change, obviously the public health tobacco cessation team plays a really important role. And when Claire and I sat down and started looking at the Million Hearts Tobacco Cessation Change Package and how tobacco control program staff would use it, we needed to first acknowledge something it says right there in the Million Hearts Tobacco Cessation Change Package document itself, that the change package is intended to be used by healthcare professionals in outpatient, inpatient, and behavioral health settings. So our goal was to create a roadmap for the state tobacco control program staff to use that tobacco cessation change package while they're coaching or guiding clinicians who also obviously need to be involved and in some cases really drive the work. Next slide, please. And as we get started, it would be a good time to assess how familiar you all are with the available technical resources. So let me turn this back over to Jen for a minute.
Thank you so much. All right, let's go ahead and engage. Please take a moment to go back onto the assessment tool, either on your mobile device or here on your computer, and answer question 5 for us. Have you seen Health Systems TA resources? This could include the Million Hearts Tobacco Cessation Change Package, CDC Best Practices User Guide for Cessation, the Lung Association's website that includes the resource library at Cessation TA, or any other frequently used health systems TA resources before today. Please go ahead and let us know. And I'll go ahead and send it back to you. Next slide, please.
Thank you, Jen. And as Jen just mentioned, these are the best practices user guides for public health tobacco control program staff. As of this month, there are currently 6 best practices user guides, which were developed to support the work of public health tobacco control program staff. So you are probably familiar with these. We'll find out in a minute when Jen gives us some results, but if not, obviously these are great resources to support the work of state tobacco programs. They were designed with you in mind as the audience, and direct resources to the guides are available in the resource library. Next slide, please. As we worked on the roadmap, we did tie into this cessation guide. It's a resource within the roadmap, and you'll see that in a few minutes when we get there. But the Center for Public Health System Sciences at Washington University in St. Louis developed this guide to help states develop and sustain comprehensive tobacco control programs. It is for tobacco control staff who provide knowledge and attention necessary to help organizations make systems changes. So you guys are the audience for this. It describes the role of an initiative coordinator who leads day-to-day project activities in health systems change, such as reaching out to clinical offices, convening team meetings, involving partners, creating action plans, and training healthcare staff. So when you are really driving the work, this may be your better guide, but the Million Hearts Tobacco Cessation Change Package is to help the clinicians when they are more involved in the systems change. Next slide, please. So the roadmap that the American Lung Association developed helps you to help the clinicians as they navigate this tool. Clearly there's some overlap between the two. You can use both to reach your health systems change goals. But for those of you who aren't familiar with it, change package really refers to the package of process improvements that clinicians can make around tobacco cessation in their health system. It's built on the concept of plan, do, study, act, or PDSA cycles. The act in a PDSA cycle is the process improvement or the change. So this is really your package or your menu of options of tried and true process improvements in tobacco cessation health systems change work. Next slide, please. This graphic is straight from the Million Hearts Tobacco Cessation Change Package. There are 5 focus areas, and the American Lung Association asked us to translate the first focus area, which is key foundations. The remaining 4 focus areas will be translated into roadmaps at a later date. Next slide, please. So as you can see here, the key foundations includes 2 change concepts that are listed in this screenshot in bold text, and each of those has 3 change ideas or goals, and those are the actionable, specific ideas for changing a process. Next slide. Don't worry, you are not supposed to be able to read the text on this slide, but the point of it really is to show you that within that key foundations, there are over 50 entries for tools or resources. So every one of those circles, triangles, and squares is a tool or a resource that the clinicians might use while they're working on health systems change. So the challenge for us as tobacco control staff is being able to easily find that tool or resource to meet your needs and the circumstances of the health system that you're coaching and supporting. So the roadmap really will allow you to not have to go through all 50 tools and read them and figure out the best ones to use. It will point you to your potential destination. Next slide, please. So before we go any farther, I want to acknowledge and thank the American Lung Association Stakeholder Peer Group, which convened 3 times over the summer to assist us by sharing their experiences and their feedback on the prototypes of the roadmap while we were developing it. The peer group was made up of public health professionals from state and local tobacco control programs, professionals working on tobacco cessation and health systems, and content experts from across the country. And while they were peers, they work in a variety of settings. So they brought us multiple perspectives and experience levels to help guide the development of the roadmap. Our team listened to the feedback that they brought to us, and some of the lessons that were really highlighted that we tried to reflect here are that health systems change for tobacco cessation is not a linear process, that there are numerous resources available. However, they can be difficult to navigate. Obviously, there are competing interests in public health, and that's especially true right now, as well as competing interests in health systems. So the roadmap was designed to address both these successes and challenges and the real world questions that were posed by the peer group. And given the folks who are around the table, or actually on our computer screens, given that it was this summer, the tool was informed by over 20 years of health systems change experience and presence with public health teams on American Lung Association and CDC calls. So a great group, and we're very grateful to them. Next slide, please. All right, we're going to jump to the structure of the roadmap, and we've talked about change concept, change ideas. The next thing we need to cover is roadmap pins. So hopefully these icons make you think of using navigation on your iPhone, probably whatever kind of phone you have, using maps. You may drop a pin to remember where you parked your car. You may see a pin like this on a map when you're looking for a specific location. What we are calling roadmap pins are the questions that you might have as the public health tobacco program team member when you're coaching the clinical team. It's our shorthand. Initially, we were calling these the public health needs, and I'll show you how that works in just a minute. Next slide, please. And just one more thing, let's talk about when is the appropriate time to use this roadmap. So it will help you if you have already selected a health system partner, you already have some understanding on the background of the health system type, if it's an FQHC, if it's a hospital, if it's a primary care group or a behavioral health group. You and the health system have some agreement that cessation is a priority. So essentially you've made the case for them to do the work. So if those things are true, you are ready to use the roadmap. Next slide. We're about to jump in, but first let's learn a little bit more about our live audience today with another polling question. So Jen, you are up.
Wonderful. Thank you so much. And thank you to everyone for your engagement in these assessment questions as well as in the Q&A box. Really love seeing your thoughts and your questions coming in. So greatly appreciate your engagement. Would really love to check in now to see the level of confidence. So our last question was all about your awareness of the different tools that are available. Now we'd love to know if you are using these tools, how confident you are in utilizing them to really help further these efforts in the state and territories that you are serving. So please go ahead and take a moment and respond to assessment question number 6 for us. And I'm going to go ahead and send it back to you.
Thank you. All right, next slide. So this is a screenshot of the actual roadmap. Hopefully some of you have had a chance to review it since the link was included in an email to everyone who pre-registered for this webcast. And if you haven't bookmarked or downloaded it yet, I recommend that you do after the webcast so that you'll have access to this TA tool. So we'll also share the link in the live event chat box because it is available now. Next slide. The roadmap features resources and tools for multiple care settings, and these are similar to the settings that are used in the tobacco cessation change package. We've added 2 additional categories. So the first one is all settings, because some of the tools and resources are really applicable for a health system, no matter what kind of health system it is. So that's the blue box, all settings. And then a subset of that is the light blue box that you see there for inpatient and outpatient. So it's a subset of that all settings without that behavioral health focus. So those are in addition to what we have in the tobacco cessation change package, and we're going to show you how that works. But the colors next to these care settings are going to help us navigate as we go. Next slide, please. All right, we've talked about all the pieces. One more time, these roadmap pins are really important because clicking on the roadmap pin next to the public health need is going to jump you down the road to where you find your resource, where you will find your resources. Next slide. In most of these, when you're looking for the resources, the pin is going to take you to a place where you can select from locations and care settings. On this one, you can see each of those colored tabs represents one of the care settings. So I can choose once I get here which one is most applicable. Next slide, please. And then the other choice I will have in some situations is between the different tools that are there. Now on this screenshot, you're seeing one tool listed for each care setting. In some cases, there may be more than one there. So next to the blue box, there's only the one tool, but sometimes there may be more than that. All right, next slide. So now it's time to take you through an actual scenario and show you how this really works. We'll say that I'm working in a state tobacco control program and I'm just getting started with a health system that's committed to doing work on cessation. I'm going to start at change concept 1, make tobacco cessation a practice and system priority. And the first change idea under that, which is identify 1 or 2 key champions and assemble a multidisciplinary team. So the first click is that I'm going to select the mile marker I want to get to. This is a screenshot for the mile markers under my first change concept and first change idea. So my choices are support the health system as they identify 1 or 2 key champions, help the key champion assemble the multidisciplinary team, or suggest a meeting agenda to get the team started as they move forward. So for this scenario, I'm going to pick the first roadmap pin. Next slide, please. The next thing I'm going to do is choose a care setting. And again, that roadmap is color coded for the different care settings. Here I have the options for all settings, behavioral health, and inpatient. In my example, let's say the care setting is a primary care practice. So I'm going to focus on the tool that is useful for all settings. That's that bright blue one. And I see that there's one resource linked there. Next slide, please. So here I'm pointing to that resource. When I click on that link, it is going to take me right to the page that I want in that resource. So in this case, it's going to take me to page 9. And then on the right side of the blue box, I get some further directions. It says, see step 1, assemble a multidisciplinary team for development of the program for the definition of the physician champion. So next slide will take us right to a screenshot of that resource. So that will open up live links from the tool when you use it. And when I follow the directions that I had, I get the language here that says, my physician champion is a physician committed to leading the hospital-wide effort. Physician buy-in is essential to the successful integration of tobacco cessation activities within a hospital. As I noted, I think this is useful to all care settings because I could tweak this language enough to make it work for a primary care group, and I can help them by giving them some direction about who they need to choose as their physician champion. So there's our first example. Next slide. Now on the same roadmap pin, if I had selected behavioral health, because that's the kind of health system I'm supporting, again, that lime green is my signal that that's behavioral health. Next slide, please. And there is one resource linked, the SAMHSA Implementing Tobacco Cessation Programs and Substance Use Disorder Treatment Settings. Next slide. And here's my additional guidance that tells me under additional implementation tips, there's a bullet about identifying my program champion. Next slide is going to take me right to the screenshot of that tool. And here I can see the language I was looking for. This person should be a dedicated staff member who can coordinate the agency's tobacco cessation and tobacco-free policy effort. Next slide. I'm gonna just quickly show you the third one if I had selected inpatient, which is the purple box there. Next slide. I've got one resource, and the next slide shows me the directions here. And sorry, you're right there at the screenshot for the tool and the language that I'm looking for. The clinical champion is someone who can rally support for the tobacco treatment program, link departments of the hospital, help navigate clinical challenges. So that's a walkthrough of a really simple concept on a simple roadmap pin and all three of the care settings that it links to. I'm going to hand the navigation over to Claire now, and she's going to demonstrate using a pin that's a little bit more complex on the next change concept. Next slide.
Thank you, Michelle. I really appreciate that. So remember, Michelle said there were two change concepts within this first building block of the Million Hearts tobacco cessation change material. The second change concept is creating a supportive environment for cessation. So if you think about it, the first one was how do I build a team? And the second one is thinking about your environment as a whole. And each building block gets more specific. There are three ideas or goals within this creating a supportive environment for cessation. The first one is implementing and strengthening hospital or clinic-wide smoke-free or tobacco-free campus policies. So overall, what's the environment like? The second one is how do you normalize quitting tobacco or quitting smoking by using mass media campaigns? And the third one is how do you make sure that the staff and employees and their family members of the system are also supported in quitting tobacco? We often think about the patients, but it's really important that the staff are as well. So what you see on this screen are the three roadmap pins, the three destinations, if you will, that you might want to do in terms of supporting a creative supporting an environment for cessation. So we've got introducing the concept of going tobacco free, helping an organization understand that they don't have to start from scratch. So that builds really on the intimidation concept, that there's lots of material available there. We're not ready to advance yet. So if you could go back, that would be great. And then the situation you get a lot of times, which is what are examples that are state specific or industry specific? Tell me someone else like me that's done this. And then moving to a more advanced scenario, you might have a roadmap pin that is, I'm working with a system and they've already started this process and they either want to go to the next level or they kind of didn't succeed and they want to know what went wrong and how to fix it. And you need to encourage them that they can keep moving forward. Finally, what are some easy materials that I can show? That really ties to the mass media part of this change concept. And then what kind of tools can I help my health system use to assess its own employee coverage? Next slide. So in this situation, the example we're going to use is I'm going to start at the very beginning, which is I want to introduce the concept of going tobacco free in a very brief, non-intimidating manner. So we're going to look at some options later that are a little farther along in the spectrum, but this is really, let's start at the beginning with a health system that you might be just starting your conversations with. Next slide. So what you can see is that takes you to a choice where we only have the option of something that's good for all settings. Michelle showed you one where you had a lot of different settings. This is one piece of material that we think is really useful for all settings. Next slide. Actually, go back one more. I apologize. You'll notice on this one that we don't have a page number. Michelle, often where the green arrow is, showed a page number. This is one where we're actually going to a whole document. We'll also want to let you know, so you can see on the left-hand side, that's the name of the material. On the right-hand column is a brief description of what the material is. Now, one of the things that's important here is that in some cases, a resource might be listed in the Million Hearts as very specific to, let's say, behavioral health or inpatient, but the content really extends beyond that setting and we think it's super useful in any setting. So we'll highlight that. So in this case, we've noted that the branding and a lot of the material is focused on behavioral health, but we think the content is applicable and it's a really terrific infographic. So we're going to give it to you to use in any setting that you want. So let's go to the next page. So here you go. Here is a little blip of the infographic this would take you to. Next slide. Okay, so that's one example where it took you to a piece of material that was good in all settings. So the next thing we're going to do is go back to this list and see what are some other options. So go to the next slide. Thank you. And we're going to pick, I want to share some examples that are either state specific or industry specific, because this is a question that I know Michelle and I encounter all the time, which is tell me somebody like me that's done this. I don't want to be the first doing it and I want to learn from my peers. Next slide. So what this scenario helps you look at is a situation where you're not sure whether you want to use what you exactly want to use. So this has a lot of different case studies and examples. The reason these are all listed here under multiple different settings is that sometimes it's important for you to show something that's specific to your state or your region, even if it's not specific to your setting. And other times the setting is more important. So for example, you see Smoke-Free Oregon, the very first example, and it's listed as useful for all settings because there are case studies from 4 or 5 different states in that document that are really applicable across all settings. Then there are also, if you go farther down that slide, there are settings that are very specific to behavioral health, and that may be more appropriate for you to use. So you can skim through all of these really quickly visually to decide where you might want to land. So next slide. This is a continuation of this part of the roadmap, so you can see. So this continues on. So let's go to the next slide. Next slide. So after reviewing the options, you decide you want to go with the outpatient setting, and this is the document that it takes you to. So in this case, you've got a resource. It's called Implementing Tobacco Cessation Services in Community Health Centers, so an outpatient setting. Now, the reason we picked this one is that in this example, the resource is actually from the best practice user guide. So remember, Michelle said we've got 2 pieces of resources that have come out fairly recently, the Million Hearts and the most recent CDC best practices user guide. And while the focus of this is on the Million Hearts, we want to make sure that you don't have to toggle between different pieces of material to get where you need to go. So our goal is to get you to the best tool for your need. In this case, the example is a very comprehensive 76-page implementation guide for community health centers, and it's got really great material. But knowing how time-pressed you are, this takes you directly to the section of it that we think provides a great example of a sample you can show to somebody about how to do in an outpatient setting. Next slide. So we've gone through 2 examples from the second scenario. The key from what Michelle and I have shown you is to try to make sure that you understand that 3 clicks on this roadmap should get you where you want to go. Michelle showed you a very comprehensive picture, and she said you didn't have to read all the things that have a lot of material, but the goal is that you can pick your roadmap pin, you can pick your care setting, and then choose your resource, and you'll get right where you need to be. Next slide. So I'm going to wrap up with this and remind you. So when we've gone through the first of 5 building blocks, so there was the key foundations, which we've talked about, but remember, there are 4 other ones. There's equipping care teams, which are the kind of tools you might give to staff, health system staff. There's screening approaches and tools so that you have consistent universal screening. There are treatment approaches and tools. And then there's a section on referral and follow-up. Now, the American Lung Association will be building on this roadmap. And so while we've shown you material for the key foundations, there will be similar work done for each of these other 4 building blocks. But you might be in a situation where you say, I have a need, I have a roadmap pin in my head that I can't find on the key foundations. And that is possible, especially if you're farther along in the system. It might be that you can't find your need addressed in this first version of the roadmap. You have a couple of options in that case. You can go to the live links for each of these 5 building blocks, and they're linked in the roadmap tool that was made available at the beginning of this session, the full-on tool, the roadmap. You can go to those, and it'll take you to the sections in the Million Hearts material, and you can skim through it yourself. Or you can contact the American Lung Association's technical assistance team. Rebecca introduced them at the beginning, and they can perhaps help you, point you in the right direction. They're also material at lung.org. So we want you to bookmark this material because it will grow over time, but know that there are lots of resources if you can't find your need right now. Next slide.
Thank you so much, Claire. So before we get to our live webcast Q&A, and we have some great questions, and there's still time to send your questions to us via the live event Q&A box off to the right-hand side of the screen. But before we do that, let's do another polling question. Jen?
Thank you so much. So we would love the opportunity to assess your utilization of those resources that have been developed by the American Lung Association, the Centers for Disease Control and Prevention, and other national partners to really help guide health systems change and tobacco cessation integration. So if you could take a moment, either on your mobile phone or on your computer, go ahead and respond to question number 7 for us. Prior to this webinar, have you used any of the components of these resources in the work that you do? Thank you so very much for your participation. I'll go ahead and kick it back for our live Q&A.
Fantastic, thank you. So as I mentioned, we have some great questions here. We do have a really specific question to one of the resources that Michelle covered for us towards the beginning of our presentation. And I don't know if you can move us back to slide 34. Way back there, perfect, thank you. So this question, Michelle, we have a question from the attendees asking if this current pin from this Change Concept 1, is this instructing the champions inside the organization, or is it for those from tobacco control attempting to assist with implementation? Can you give us a little more clarification on how people in a tobacco control program might use this resource?
I would be happy to, and yes, this does get a little bit confusing. So again, the Million Hearts Tobacco Cessation Change Package intended audience is clinicians. So you may have a case where a clinician is using this and navigating on their own and finding it. But if you are in the position of helping the clinicians and want to see what kind of tools are available to them, this is going to point you. So if you have a health system that says, yep, we want to get started, we don't know how to pick our champion, then you could potentially take a look at some of these and say, okay, well, the person you need to pick to be your champion, and in this case, in the behavioral health setting, and give this small description. And I guess the way that this makes sense to me is when I was doing systems change work in Colorado 10 years ago, we realized that a lot of the challenges that the physicians were having when we were training them on the guideline were really what words to use. So in some ways, this sort of gives you the words to use when you're talking with that health system to tell them, this is the kind of person you want to select. It's up to them to tell you who that person might be once you give them a description, but it's really to give you the words for that interaction. I don't know, Claire, if you have another take on that, or if that was helpful enough.
No, Michelle, I think that really clarifies it. I mean, it's really about you helping to coach the health system through this process and giving you the tools you need to feel comfortable doing that.
Awesome. Thank you both so much. I think that really clarified things for us. So we have another question / comment. Someone asked us or told us that they're new to working in tobacco control and they'd like to learn more about available resources. So I am happy to take this one for the team. So you can get this resource as well as lots of others at our website, and that website is lung.org/cessation TA. And I'll put that in the Q&A box, and we'll be sure that that'll be linked as well in one of our final slides. So you can find the roadmap there. You can also connect directly with the technical assistance team here at American Lung Association. So our team can help you in one-on-one scenarios and through coaching via email or video chats or on the phone to really help you get a good grasp on the tools that are available for you to use, whether you are brand new to working in the world of tobacco control, or if you're a seasoned pro and you're working on some more advanced topics in health systems change and tobacco cessation integration. So we're available 5 days a week to help you out with whatever you need when you need it. Jen, do you have anything else to add for anyone that's brand new to working in the world of tobacco control?
I would, definitely echo, the advice that you had provided, Rebecca, in, take every network opportunity you possibly can. Sign up for the listserv, really interact peer-to-peer across state lines with national partners, just reaching out and collaborating, learning from others. I think that really is the key to success and getting, involved there, in the world of tobacco control. There are so many veterans that have been doing this decade upon decade that are a wealth of knowledge, and just really intriguing to talk to about the different strategies, challenges, lessons learned, best practices. So network and peer-to-peer collaboration would be one that I would also add on there.
Absolutely. Thanks so much, Jen. Another question that we have is, how do we engage providers to address tobacco cessation when there's competing priorities and tobacco seems to be on the bottom of that list? And we got a couple of comments about this as well. And whether it's COVID related or other topics being prioritized above tobacco cessation. I'd like to throw this to Michelle and Claire. I believe we have some resources linked that might help provide some support with that in the roadmap.
Michelle, do you want to start with that and then I'll jump in?
Yeah, I am happy to. Again, when we started this, we said using this roadmap is helpful when you've already sort of made your case. So the roadmap itself may not have the tools to help you get there, but the cessation best practices guide does help you in making the case. So that's certainly the first place I would go. And then there is also a set of resources on the American Lung Association website that relates tobacco cessation to other clinical areas that may be more of a priority for the health system. And I don't know if I could point you exactly to those, but I'm betting that we can do that in a follow-up email or something, Rebecca. It's the tool that you guys have on community needs, community health assessments.
Absolutely. We will definitely, I will put that in the Q&A box, and I'll also include it in a recap that'll go out to everyone. That's a great resource. Absolutely. Thanks for bringing that up, Michelle.
The only thing I would add to that is that, so that resource goes through about the top 15 priorities a health system might have selected in its community health planning. So they may have said, we're going to focus on opioids, or we're going to focus on mental health needs, and we're going to focus on, other issues that are not directly tobacco. And it gives you talking points for how to say tobacco impacts that. And so that's helpful. There's also, you might hear, ALA has other resources. They have billing guides, supports, et cetera, all to get to any kind of question you might get that say, well, tobacco isn't that important because I don't get paid for it, or because my hospital is prioritizing mental health, or because. So I would really recommend looking at those resources, but also starting with the most recent user guide from the CDC, because it really does provide some great material for building your case. But so does the material in the second change concept, which is how to create a supportive environment, and it does give some information on what it is and how to make the case for and make your environment better for tobacco without necessarily walking away from all your other priorities. This doesn't have to be an either or.
Fantastic, thank you. We did get a question in the Q&A box just a few moments ago asking what the charges are for technical assistance from the Lung Association. So I am excited to let you all know that all of the technical assistance that we provide to everyone working in public health, working towards furthering tobacco cessation integration is 100% free. There's no charge for our technical assistance, whether that technical assistance is through our on-demand resources or through one-on-one consulting with us. We are happy to help you any way we can, so there's absolutely no charge. So please take advantage of this free resource to help you and support the great work that you're doing all across the country. So we also have another great question that's asking, how will the resources in the roadmap be updated as new resources become available? That's a wonderful question. So I believe, I apologize, I can't remember if it was Michelle or Claire mentioned that this is going to be a growing living document that is continuously updated and added to. So what I highly recommend that you do is that you bookmark the link to the roadmap. And we've shared that link in the live event Q&A section. So bookmark that in your browser so that you can go back to it, and we'll update through that same link, that same document. And we will definitely be adding to it as new resources become available. And we'll be adding to it as well, looking at the other key focus areas of the Million Hearts Tobacco Cessation Change Package. You can also take a look at our resource library available on lung.org. So the resource library is really another great one-stop shop to access all kinds of resources. That page is continually updated by our team, and it includes both American Lung Association resources as well as CDC best practice guides and guides from our partners across the nation and national networks, all working towards furthering tobacco cessation integration. Jen, anything to add to that?
You know, I was actually thinking back at, I was still kind of considering the question about that return on investment and the how to really make this a key priority. And I believe that that is a question that we hear repeatedly coming up time and time again. So if it's okay, I would love to just give a little extra piece of advice on kind of how to navigate making this a priority. One of the key aspects is really understanding what requirements are going in to influencing what is implemented in the EHR. So, the organizational priorities, the cost, clinical and staff roles, decision support, quality improvement initiatives, incentive programs, reporting requirements. So there's a lot that influences what they're prioritizing. And so making this a priority. Of course, quality measures are always a great avenue. But also reiterating that this is, tobacco use and tobacco-related conditions. This is a chronic condition that must be treated with every patient visit. This is not a documentation on, a health record of a lifestyle choice this must be treated just as any other chronic condition is. So I believe, taking that to the table and also use these resources to back you up in those conversations. I think about the Surgeon General Report 2020 on cessation and, seeing that even though, yes, brief interventions have increased, since 2000, at the end of the day, unfortunately, not all patients are being asked or referred and given advice to quit with their visits. 4 out of every 9 adult cigarette smokers who saw a health professional during the past year did not receive advice to quit. So I think some of these key factors in making this a priority and understanding the positive benefits associated with hitting home, asking, advising the quit, and helping to refer the individual into a tobacco cessation program, the true return on investment that this would have, not only for the healthcare provider and the organization as a whole, but the trickle effect of the positive health benefits and improvement to overall health of that patient kind of head to toe. So would love to offer up again our listserv and two-way communication to continue this discussion. If you have had a really powerful statement or something that really seemed to resonate that assisted with getting that leadership buy-in, we would love to prompt you to toss it out on the listserv, and let's keep that conversation going and identifying kind of those best practices in that leadership buy-in.
That's a great idea. That peer-to-peer sharing is really invaluable. So thank you so much for bringing that up, Jen. And something you brought up as well is, brief interventions, right? Ask, advise, refer. So someone actually just asked us a couple of minutes ago if this could be utilized with an ask, advise, refer toolkit for their state. So does anyone want to catch that one and kind of address how our roadmap could be used alongside another toolkit?
I think if this is Claire, I'll take a brief shot at it and then open it to others. But if the toolkit that you have right now is developed for the provider community, for health systems community, it could be where we've used, the Million Hearts team has identified resources from around the country, and they may or may not have identified your resource. It may be a new resource. It may be very specific to your state. So I would treat any resources you have as supplements that you're intimately familiar with, whereas the material on the roadmap may be information you're not as familiar with, tools and resources you're not as familiar with. So if you have a toolkit and you take a look at it and you say, gosh, this is already specific to my setting and my state, I don't really need to be looking for a new toolkit. You wouldn't go to that roadmap pin. If, on the other hand, you had a toolkit that's specific for your area or for your setting, behavioral health or whatever, but you encountered a health system saying, yeah, but is anybody else doing it? Which, again, we encounter all the time. You might want to say, here's what we've developed, but here are also some similar materials that you can look at if you prefer, and there's other resources. So I think it's, if you're trying to offset skepticism that, only your material may not reflect what everybody else is doing, go to the roadmap. If you feel like your tool is already so specific to your environment, then that probably wouldn't be a pin you'd select on the roadmap.
Thank you so much, Claire. That really that helps to address. We've gotten a few other comments about, creating that buy-in and building trust from providers and health systems. So that was a really great point. So we are getting close to the end of the hour. So I do want to let everyone know that there are still a few questions that we haven't had time to address yet. And our team will definitely be reaching out to you one-on-one to answer the questions you've sent us. And next slide, please. I also want to share with you our email address. So, if you have any last minute questions or questions that come up for you tomorrow or next week or next year, you are welcome to email us at cessationta@lung.org. We are happy to answer your questions. And again, as I mentioned, as you use this public health roadmap, you can email us at any time if you have questions about it or if you need additional support with the work you're doing around cessation. And our email address is listed on the screen, and our link to our technical assistance site is as well. So it's lung.org/cessation TA. And that listserv that Jen mentioned a few minutes ago, that great resource for peer-to-peer sharing and support, you can join that by sending an email to support@cessationta.lung.org, or you can find the subscribe form on our resource library site there at lung.org. So next slide, please. Awesome. So again, the American Lung Association, we truly appreciate your feedback as we work to assist you and other public health professionals and tobacco control programs to promote health systems change to increase tobacco cessation. So the post-webcast needs assessment link has been shared a few times with you in the live event chat box, and we'll also send out a link if you haven't had a chance to access it during the webcast. So we would really appreciate you taking just a few extra minutes to fill out this quick questionnaire to help us best serve you. Jen, do you have anything else to add to that post-webcast needs assessment?
We just so greatly appreciate everyone's participation. It really helps us to, plan ahead on how we can best support the work that you all are doing. So just want to add on and just give my thanks to everyone for taking time to give us that feedback. The remaining questions in the assessment should not take too long. If there are any other topics associated with tobacco cessation and health systems change that you would love to see American Lung Association offer a deeper dive into, or resources where you notice there are gaps and you could really use additional tools to help further your efforts, please let us know through that assessment, and we'll be sure to follow up and continue the great collaborative effort in peer-to-peer sharing, and American Lung Association is always here ready to support you. So thank you for participating.
Thanks so much. Next slide. So from all of us at American Lung, we want to thank you for your time and participation today and for sharing our vision of a world free of lung disease. This now concludes the live webcast.